Well, if you're a longtime resident here in Orange County, you are very familiar with the good work done by Hoag Hospital, originally in Newport Beach, and that facility continues to serve Orange County, but the new facility now in nearby Irvine. Joining us today is Marcy Brown, the Vice President from Hoag Hospital Irvine and the Hoag Health Center Operations. Marcy, welcome.
Thank you so much. What a treat to be with you.
It's great to have you on the show today. You've got quite a background. Your background is in, I was saying radiology, but the correct word, I guess, is imaging today. Yeah,
right.
Is we've all kinds of tests and things that used to be invasive are
non-invasive, right?
Yeah, with that. But you're also working in something new over there at Irvine, on the Irvine campus. In fact, we drove by it the other day, and I said to my wife, what is all of this? All of this is the new health center operations over there in Irvine.
Right, Hoag Health Center Irvine, Sand Canyon. We broke ground January 2015, and we're getting ready to cut the ribbon here. So a lot of work's been done, but we're excited.
As you know, the name of this community is Laguna Woods Village. You're calling it the Healthcare Village.
We are.
Expand on that concept.
We are. Well, we took our inspiration from Irvine and its villages, and we thought what better way than to create a health center village. So you typically are, used to going to the hospital for surgery or emergency room care or kind of an acute episode, but we thought we really needed to create a place where you could receive that before and after care, if you will. So for all the other times in your life when you need access to health care, to create a space where care is coordinated, all the specialists are collaborating together, and all the programs are housed basically in one village, our healthcare village.
It's actually right across the street from the main hospital.
It is. So 3 buildings, 50,000 square feet each, housed all of our institute programs. So we've always had Hoag Orthopedic Institute, so that's been there since 2010. And now with the launch of this new healthcare village, we'll be having Hoag Neurosciences Institute, we'll be having our Hoag Family Cancer Institute, and we'll be having our Women's Institute and Heart and Vascular Institute.
So a lot of things that we would normally either have done in a doctor's office or in the big hospital are now going to be just across the street in this new facility.
That's exactly right. So for example, we'll be having the Schenkel Clinic, Orange County Vital Aging. Well, we'll be sure and take care of your cognitive health and early detection of Alzheimer's and treatment for Alzheimer's. In addition to that, the Cancer Center, in the past, you've had to drive down the 55 and go to Newport Beach to get access to Hoag branded radiation therapy, chemotherapy or infusion, as well as an urgent care center. So we're going to be opening an urgent care center in the fall.
I think the reality for a lot of people is there's so many things that we have to look forward to, unfortunately, in our life of healthcare. And it used to always be the hospital. You would always go to the hospital. You'd always go to the ER. Obviously, with trying to control healthcare costs, with the insurance, with the government involvement, hospitals are trying to come up with better ways to serve the public, mindful of the dollar, also mindful of the latest in healthcare treatments.
That's exactly right. I mean, we were all about being accessible and bringing those Hoag branded services to the community, but we don't want to be accessible without being affordable too. So we're constantly looking at ways to be more efficient and drive the costs of healthcare down so that we can be accessible to all.
Your field of imaging, I would imagine there's going to be some, probably already are some things off-site, away from the main hospital, that also deal with imaging.
That's exactly right. We've always been committed to having the latest advancements in advanced imaging technology in all of our health centers, including one just down the street in Aliso Viejo. But in addition to that, we will have one of the most advanced imaging centers in the center building in that healthcare village.
Right. So a lot of things that, again, normally would go to the hospital for, it's going to be across the street.
That's
great.
That's right.
Talk about our residents here in Laguna Woods Village. How can they benefit from this new center?
Well, I would say the number one benefit is convenience. We are literally just 7 miles up the road, less than 15-minute drive right off the 405 freeway. We're going to have a care coordinator on campus. So for your residents who feel like it's just really tough to navigate through healthcare these days, you leave your doctor's office with a referral slip and a phone number to call, not knowing if your insurance is going to cover it or if it's out of network. So we have care coordinators on campus to help your residents navigate through the process of appointment making, create an itinerary for them. We'll also be committed to having complimentary shuttles to the campus from Laguna Woods.
That sounds like a super idea, and again, some good ways for our folks to get a better take on the latest in healthcare. We hear so much today about breast cancer, women being aware of self-examination as well as screening, and you're going to be doing a lot of that off campus.
That's right. That's right. We have that in the new health center, in our comprehensive breast care center. And in addition to just having the screening mammograms available there on site, we'll also have, if we happen to detect something, for the first time we'll be able to take that patient through full diagnosis and treatment in that one healthcare village.
I know from talking to women that have gone through this experience, one of the worst things is they say, we'll call you. And then 3, 4, 5 days later, a week, 2 weeks later, you get the call, come see the doctor. You're trying to eliminate as much of that wait time as possible.
Absolutely. If you're having a diagnostic mammogram, we're going to get you answers that day. So you will sit down with the radiologist and the surgeon if need be, and we'll create a pathway to get you cared for in a timely manner.
One of the people I watch a lot on TV is Ariana Huffington, Huffington Post. A lot of people read the things that she has in there. She's written a new book recently on the subject of sleep, and I understand a sleep center will be one of the things you're going to have there at the campus.
That's right. That's right. When we looked at the number of residents in Irvine and South County that were accessing our Hoag branded sleep center in Newport Beach, we thought, wow, we've got the demand. We're building a 4-bed sleep lab on the campus as well. So we'll be doing sleep studies after hours there in the village.
So people actually will come in, get wired up.
Yep.
Take a sleep, go to sleep really, and you'll see if
and we will monitor them.
If they're doing right or not. So somebody else is going to stay awake and watch them, I guess.
That's right, our sleep techs. That's right.
That's great. I know that's been very successful down in Newport Beach, so this is additional there in Irvine as well. If somebody wants to find out more information, they can contact the hospital direct, or they can go online, I understand, as well.
That's right, and there's a Hoag Health Center Irvine Sand Canyon website where you can go on there, look at the directory of services, the physicians participating in our programs. And also, I want to be sure and invite all of your residents to our open house, Saturday, September 17th from 8 a.m. to 2 p.m. We'll be having free flu shots. We'll be having guest physicians come lecture on interesting topics. We'll be having tours of the site and lots and lots of opportunities to learn more about the programs and complimentary shuttles from Laguna Woods.
That's great. I know every fall we all need to think about that, especially those of us over 55. More important than ever with so much out there. We're hearing so much about communicable diseases these days. One thing is that we can at least do our part to help cut down on the cases of flu.
Get your flu shot.
Yeah, it's very good.
That's right.
Let's talk about a little about your specialty, which is imaging. I'm hearing now that one of the, shall we say, least pleasant tests that we all find ourselves involved in is colonoscopy. There's something new out there called a virtual colonoscopy.
That's right.
What's your take on that?
Well, it's interesting. I just had my screening colonoscopy a couple of weeks ago, and I sat down with my doctor and went through all of the options, and that was one of them. It's a personal decision, but you still have to go through the prep for the virtual colonoscopy. And this is just my opinion. It's up to a conversation between you and your doctor to decide what's best for you. But if they detect something on the virtual colonoscopy, you still have to go back in and have their traditional colonoscopy to have a polyp removed, for example. Right.
As I understand,
I wanted the one-stop shop.
Yeah, I kind of agree with, having been through it myself, I kind of agree with you that that's maybe, at this particular point anyway, the way to go. But for some people, might be a good option.
That's exactly right. So like I said, it's up to you and your doctor to decide.
A lot of people also are concerned, obviously, about their insurance, and you folks tend to work with all the insurance companies as well.
That's exactly right. We have a very, very broad network of insurance coverage, and we have a whole team of experts, actually, that would be willing to come out and talk to the Laguna Woods team about what plan that you have to enroll in to make sure you get all of Hoag. And you want Hoag to be in your network and be your hospital and your healthcare village. We have a team of experts to walk you through that.
And if someone's new here in the community and they don't have a doctor yet, that's one of the things you need to find out, along with a mechanic and maybe someone to cut your hair, is a doctor, and you folks can help them in that area as well.
That's exactly right. Our network of physicians in Hoag Medical Group is growing every day. We tend to think we have the best of the best and the brightest. So yes, we do have a Hoag Medical Group team standing by to help you enroll and pick a doctor.
For more information, you can go online, hoag.org, or you can just call them up or drop on by and find out more about what's going on over there in Irvine at the Hoag Hospital there. Marcy, thank you so much.
Thank you so much, Rob.
Good to have you on the program today.
Thank you.
We'll be coming back with more news and more guests as our program continues, so stay with us.